Hello everybody, my name is Jade Annie. I'm a consultant clinical pharmacist. Today on our health education and hypertension series, we are discussing sleep. How your sleeping habits is affecting your blood pressure. So, what is sleep and what is not sleep? People talk about insomnia. Insomnia has to do with poor sleep. What exactly is insomnia? By definition, before your doctor will conclude that you have insomnia, he has to check out some facts, and you need to have the right information to give to him. So insomnia has to do with being unable to fall asleep. Some people can't sleep. They try to sleep, but they can't. While some can actually fall asleep, but they are not able to stay asleep. Some will sleep. Let's say you go to bed in the night, 3 a.m., 4 a.m., 5 a.m., the person is awake doing nothing and they just can't sleep anymore. So if you fall into this category and you are having a problem sleeping at night, not that you are taking a medication, because sometimes you might be on a medication and this medication will kind of force your system not to be able to sleep. In that situation, you do not fall into this category. And in this category are people who have this problem like at least 3 times a week. Not that you didn't sleep last night or you now conclude that you have insomnia. No, you should be worried when you are not able to sleep consistently. What we talked about, not being able to fall asleep, not being able to stay asleep when you have fallen asleep. If you're in that category and this happens as often as up to 3 times or more in a week, some people a whole week straight, they're always waking up. They say, oh, once it's 3 a.m., 4 a.m., I'm awake, I can't go back to sleep anymore. And that becomes a problem when it happens like that every other week for up to 3 months. I know people who, they can't sleep, like it's been years upon years, they really can't sleep. And they don't see it as any big deal. Really, you need to talk to your doctor about it. It's a problem, and we will talk about how that relates to your blood pressure, right? There are blood pressure patients which are under my monitor. They will say, oh, I was not able to sleep yesterday and my BP shot up. You know, your BP can go up, yes, because you're not able to sleep, because you actually need sleep to be able to, your brain needs to relax to control a lot of all the metabolic processes in your system. But it's usually not just that sleep of that day that caused the problem. Most often, you find out that this person had developed the habit of not sleeping. So let's go to the next topic. Why do people not sleep? Why do they find it difficult to sleep? There are individuals who take psychoactive medications. You know, psychoactive drugs, I mean like nicotine or amphetamine, maybe recreational drugs they use in getting high. Most times, those kind of drugs dysregulate your sleeping pattern, and that's a problem because it's in the same brain. You are sensitizing the chemoreceptor trigger zone. You do not expect the system to function properly anymore. So even caffeinated coffee, some people are used to taking coffee. Oh, I love coffee, and you see how many grams of caffeine in their coffee. Is troublesome because if this is affecting your sleeping pattern, you need to do something about it. While some people, their case is not related to anything that has to do with drugs. They just can't sleep. Maybe it's genetic. Some people, it's their environment where they live at. Their system is reacting, you know, to the conditions around them. Maybe they are worried, emotional and psychological problem. During the diagnosis for insomnia, the doctor has to look at a lot of other factors before he concludes, you know, but majorly is to find people who are going through phases like, I couldn't sleep as much as I wanted to sleep. So I couldn't say that's insomnia because I wanted to sleep, but in the process of having babies, they will not let you sleep, because especially if you are doing exclusive breastfeeding. That's why a lot of women run away from doing exclusive breastfeeding. So you find more and more women having the challenge of not being able to, okay, let's see if this light is going to come on. Yeah. This thing is so damn bright. So you find more and more women not being able to stay asleep. After they have breastfed babies over the years, their system begins to not want to sleep anymore, because in the night they're used to doing one thing or the other, feeding the baby, breastfeeding the baby, changing diaper. So that interruption, the system begins to see it as normal. So you also have individuals that, I don't know, someone is asking to go live with me. That's Sunday. Hello Sunday, how are you? Okay, let's go on. You also notice that some individuals, they can't stay asleep because they had conditioned their system to work all through the night, and they have deadlines to keep. Because of this, when they now truly want to sleep, they can't, because their body is conditioned to stay awake to be able to achieve one certain target or answer emails or do this and that. I hope you can all hear me, because my microphone is here and I hope it's functioning properly for you. So do buzz me, say something about the microphone if it's having a problem. Okay, so as we were saying, all these factors can mean that an individual will not be able to have regular sleep on a normal day. You ask yourself, oh, sleep, does it really matter? Yes, it does matter. The brain is very important. The brain function, the brain rest is important. So that period of sleep is the period that your brain goes into proper sleep. Some people even sleep and they don't have deep sleep. The sleep is not deep enough. That's the quality of the sleep is not deep enough, which is a big problem too. That you are sleeping like you're sleeping on the surface, where you have a higher level of rapid eye movement. So what we're saying today is, with respect to your sleeping habit, you have to, on your own, decide to sleep properly. But why do we know that sleeping pattern affects the blood pressure of people? These things, as I told you earlier, might not happen today. It might not even happen tomorrow. But you're looking at staying on this earth up to 60 years. And then you begin to pay for all the times that you did not live well. So let's look at the studies that have been done over the years. The first study that opened our eyes deeply to issue of sleep were done by Chinese scientists. They looked at over 100,000 young people. These 100,000 persons were categorized into two. One half slept for maximum of 4 hours a day, right? The other half slept for about 7 hours a day. Now, in this study, at the end of the day, they found out that people who slept up to 7 hours a day are able to have lower chances of developing stroke and cardiovascular diseases. It's not only Chinese that did this, so let's not say, oh, maybe this is for Chinese people. I remember very well, there's a young man, he's an entrepreneur, a well-known name, young and rich, a millionaire from Asia. He was giving a talk one day. He said he sleeps less than 4 hours a day. He's a tech mogul, and I'm like, why do you sleep less than 4 hours a day? You are very rich, but when you are making it in life, you want to stay on top, you want to make more money, you want to sustain your business. He said he slept for 4 hours a day. I was not happy. Later on, the young man died. He died before the age of 40. I'm not saying it has to do with that, not being able to sleep, but there are factors that contribute to your system packing up very early, right? The most annoying one is people who stay awake to watch movies all through the night. I mean, like you should sleep rather than watch movie or do anything that is not very important. Going back to the studies we're discussing, they found out that people who slept up to 7 hours a day, they had better quality of life, and their chances of developing stroke and cardiovascular disease were lower. There was another study done in America. This one, they used 150,000 young people. And in that particular study, they found out that people who slept between 7 and 8 hours a day had better quality of life than people who slept less than 4 hours a day. So less than 4 hours a day was known to be associated with stroke. And this study, the one done in China, was done for 14 good years. 14 years of follow-up. So it's not just 1 day study, 2 days, 1 year, no. So you see how important sleep. We do not know exactly how long any human being should sleep. But from the studies, we can tell that the best number of hours you should sleep in a day is minimum 7 to 8 hours. On the converse side of this discussion, if you sleep up to 10 hours in a day, is also associated with health risk. Yes, the truth is, when you sleep too much, it's not good for your brain. Your brain needs a quantum of activity and wakeful time for it to be said to be healthy. There are other medical issues associated with oversleeping, but a normal human being should target at least 7 to 8 hours of sleep in a day. That is the one that will give you the best benefit, the best outcome. No matter what you are looking for, we are all going to pay for any of the health rules that we disobey as young people. The problem I have with speaking to young people is that because they're very young, they have not experienced any disease. The best they know is one that their fathers complain of. The complaint of old age is too numerous. You want to enter your old age with minimum number of diseases. I can tell you that because I had old parents and I know the drill. Like if you are going to have to pop pills, take drugs for all the diseases that you come down with at old age, you might end up not living long. So sleep is important in the control of your blood pressure and other cardiovascular functions of your body. And we also want to look at how can someone sleep properly. Don't just say, oh, sleep is good. So how can you sleep? In case you're already having problems with sleeping, first of all, check if there are medications you are taking at that moment. Probably prescription medications that your doctor has given to you. It's your duty to go back to him and say, oh, this pill, since I started using it, I don't sleep properly anymore. Because he understands that you need to sleep. That is one. Apart from the medication you are using, you also need to check your environment. Some people need an extra quiet place to sleep. Some people can sleep right under a television. It's not proper to sleep under a TV sound, right? But some people can sleep under that environment, but some people can't. So what do? You afford yourself that extra quietness. If you have kids, you might want someone to take your kids. As you get older, 30, 40, you find out that the things you could do easily with yourself, you can't possibly do it anymore. Please, if you like our video, help us share on your timeline so that your friends can also join in watching. So what were we saying? Give yourself that extra quietness. Some people go as far as making sure that the room is dark. Like they use a dark colored rug, dark colored bed sheet, dark colored curtain. So everything in the room, the darker the better. So when the environment is dark, you tend to want to sleep more, right? Now, another thing is take your mind off worry. You might want to think of doing yoga. Some things you go through or we go through in life, they are so stressful that when you want to sleep, instead of your mind shutting down, your mind is thinking about it. Maybe you are angry. Maybe you are panicked about a situation that you can't help. Instead of going into the wonderland of anger or panic or fear, deprivation, take your mind towards the angle of being happy. Think of the things that make you happy. These are things that yoga classes can teach you. Meditation classes, right? They try to teach you how to control your mind. It's easier to sleep when you are thinking of a happy place than when you are fearful, sad, angry, and the rest. So that's about making your environment ready. But you can actually go for a body massage. The economy is not good, right? And so many people can't afford a massage. But you can do a homemade massage. Your partner, your family members can do a massage on you. Because sleep is very, very important. Sleep is this silent thing that is just there. You don't think is important. You're not even measuring. I'm sure so many people, they don't sleep up to 7 hours a night. They don't sleep up to 7 and they don't care. They will start to care when the things begin to show in their body. So you might want a family member or go to a massage parlor and, get body massage, foot rub. These things are known to enhance your ability to sleep and to sleep well. Not just sleep, there's some sleep you'll be sleeping, you'll be having dreams. There's some sleep that you sleep You will not even have any dream. I mean, like, you'll be having horror dreams. While there are sometimes you sleep, you don't have any dream. So you are sleeping what they call quality sleep, because every sleep is not the same, right? Every sleep is not the same. So you want to make your environment conducive, soundless. Some people like some certain kind of sound, like classical music, white sound. Have you ever heard of a white sound before? So I want you to check out online what a white sound means. So some people use white sound to sleep because those kind of sounds, they make you want to sleep. They make you want to sleep. So there are things also you can take, right? There are supplements you can take. Okay, we talked about earlier about caffeine, nicotine. If you're a smoker or you like caffeinated coffee, please, and you are struggling with sleep, this is the time to dissociate yourself from anything that is a psychoactive substance. If you're on drugs, maybe cocaine, amphetamine, you need to stay away from those things if you really want to achieve a good sleep. So that's about the things you can do. Let's look at supplements. There are supplements you can try. Vitamin Bs. The vitamin Bs are very good at helping people sleep. Chamomile. There are lots of varieties of chamomile tea, and omega H3. Omega H3 is also powerful when it helps the body to relax. But this might not have the kind of effect you want, right? So you have to start to try the physical and the supplement aspect. When it doesn't work, then you should hit the doctor. You should also actually go to the hospital for a proper evaluation. Maybe at that point, you'll be placed on sleeping pills. I usually don't advise people to start sleeping pills on their own. And I also try to encourage them to try out other things that they can, and also keep the right information for your doctor. Don't just appear. The doctor will ask you, when did this problem start? You can't tell. How many hours do you sleep in a day? You can't tell. So these information are very important. How long you sleep in a day? Keep a tab, keep a note, find out what you can do. Because, why are we discussing this now? Remember the topic. We're still talking about hypertension. This will definitely affect you and your blood pressure in future. So people who have this issue with not being able to sleep, insomnia, they have a higher chance of developing high blood pressure later. And even those who had actually developed high blood pressure, you find out that managing it with poor sleep is often difficult. The doctor will combine the first drug, combine second drug, third drug. Before you know, he doesn't know what to do again. He's just like, okay, maybe we should try something else. Before you know it, the person begins to progress in high blood pressure, from there begin to develop secondary diseases and all that, and the system packs up. So you want to do all you can to stay healthy a longer period of time on earth, right? I always tell people, invest in your health. Invest in your health. One of the ways you can help us to pass down this message is by sharing it on your wall, right? And most importantly, we are always having one cycle or the other. The present cycle we're doing, I think I will announce the day the registration will end. I will announce that on my blog, on my page. And the registration for our high blood pressure class is just 2,500 naira. The funny thing is that the discussion on high blood pressure is so vast, right? That's why you hear me discussing every day on this, and the topics are not finishing. So what we need for you is to invite your old parents who are already down with one disease or the other, or are not. What will it benefit them? They need to hear this and be able to do better. When they do better, it saves you a lot of money. When somebody is not sick, are you going to spend money carrying the person from one hospital to another? You want them to live longer and happier. And in this class, we don't do it like normal class where people are expected to read. No. We have audio, we have visuals, and we'll have the written books too, where the clients can benefit from. What we try to do is people who can't read can actually hear. But if you do not understand English at all, trust me, this class is not for you. So the only prerequisite is that at least you can hear and understand English. Even if you can't read it, you can hear and understand English. So I am opening up the class. Why I made it so cheap is that I want young people who are not in need of this lecture right now to get it for their future. to get, I know you don't have any hypertension, you don't have any diabetes, nothing. So, but you need to be informed so that you start now, because I've noticed that most times, when somebody is already down, especially at the end stage, there's virtually very little that medical science can offer the person. But you see, health education and prevention helps the client far more than treatment, especially with disease conditions that are chronic, right? Especially one of them is one of them is hypertension. So you find a situation where someone has hypertension and the person is not able to live for the next 10 years because he's not doing the right thing. I remember people come into the clinic, they want to see the doctor, they want to talk to the nurse about this or the pharmacist. Everybody's busy. Of course, we know how many of our healthcare professionals that have been taken out of Nigeria recently, right? So people don't have the time to discuss these things extensively with you. So you need to sit down with someone that will take you through the process so you live a better and longer life. Do this for yourself and your loved ones. So that's all on sleep. Tell me, do you have a problem sleeping? Have you ever had a time when you couldn't sleep? What did you do? How did you help yourself? Oh, you say bring them on camera. Sorry, what does it mean? One neck egu. Bring them on camera. Okay. I don't know what he wants us to bring on camera. Oh, thank you very much for listening. So you can still drop your message on this topic and we will still answer if you have anyone. So, but I wasn't able to understand what she said or what she meant by bring them on camera. So thank you very much. This is Orange Smile Health 2 on Facebook. And this is the end of our talk today. So expect us to say more tomorrow. Thank you.